So gabapentin is a prescription medication that's indicated and FDA approved to manage the symptoms that's involved with neuropathy. So it can be diabetic neuropathy, like alcoholic neuropathy, vitamin deficient neuropathy, but it helps us treat the symptoms of it. It doesn't treat the disease, it doesn't cure the disease, but it allows the patient to feel more comfortable. But if you want to get a little bit more detail, I love my science. But when it for gabapentin itself, it essentially it slow it I wouldn't say it slows, it alters the neurotransmitters. So like I said earlier in the conversation, the neurotransmitters aren't doing great job because they can't really tell what's going on, because whether it's a diabetic neuropathy where it's glycosylation, or alcoholic neuropathy where it's toxins, and it's kind of preventing these communications, because you need neurotransmitters to be able to, like I said, communicate, for your brain to be able to communicate with your toes. So basically they release chemicals, and I want to get into the specific names of them, be more confusing, but they're neurotransmitters. So what gabapentin does is kind of alters it and slows it down a bit, so it doesn't be, so it does not allow, that same symptomatology or pain symptoms to occur. And basically we would consider kind of like, I wouldn't say deaden it, but just kind of makes it more calm and at ease. And then the patient feels at ease and there's not as much pain going on. So it's not because it's not like the nerves are excited per se, because they're just not doing their job. So it's like almost like kind of telling the neurotransmitters, just take it easy, kind of keep it tranquil, and hopefully that analogy kind of helps. So that's what gabapentin does when it comes to managing those symptoms. So kind of just keep it quiet, keep it quiet, and that's what it does. And the only issue is when it comes to gabapentin, I have to admit, you can't take gabapentin if you're going to operate in heavy machinery. And I talked about earlier, some of my patients that have neuropathy work with heavy machinery, and heavy machinery also includes driving a car. So if you take gabapentin and drive a car, you're putting yourself and the people on the road at risk. So you have to be careful at the times that you're taking gabapentin. And if you're going to do, and that's when we talked about earlier, augmenting with supplementation, that maybe you can do that during the weekdays, and maybe take your gabapentin on the weekends when you're trying to get some rest. Things like that is the way I kind of you can mix and match it, but we can discuss that moving forward. But to answer the question, gabapentin is a prescription medication that treats the symptoms by augmentation of the neurotransmitters, which is how the body communicates nerves. That's the answer to the question.